Good morning, everyone. You're welcome to today's orientation. I've been asked to speak on the topic becoming a 21st century doctor. Medicine is no longer defined solely by stethoscope, prescription, clinical competence, technical skill, and hospital corridors. No, the doctor of today and tomorrow embodies far more. We live in an era where healthcare intersects with technology, global systems, and human compassion in new powerful ways. So becoming a 21st century doctor means you have to do a lot. It is no longer the traditional doctor that we know. Now, who is a traditional doctor? A traditional doctor is primarily seen as a medical expert whose main role is to diagnose illness and provide treatment. They focus on clinical knowledge and medical treatment, hospital-based practice, disease diagnosis and cure, patient examination and prescription, authority-centered, limited use of technology, and curative and individual-focused care. Now, the traditional doctors believe that patients are they believe that patients are recipients of care rather than active partners in their health. So becoming a 21st century doctor means that you have to be patient centered. You have to embrace patient centered care. And what it means is that you listen deeply to your patient, respecting cultural differences, and partnering with patients in decision making about their health. Why? Patients of today are informed, they are empowered, and are involved. So they expect not only treatment from you, but empathy, dignity, and respect. Becoming a 21st century doctor means you have to embrace technological transformation. It is also means that embracing technological transformation means that you have to stand at the frontier of innovation and technology. Artificial intelligence, robotics, genomics, telemedicine, and digital health platforms are transforming how we diagnose, treat, and monitor disease. So the modern doctor must not fear technology, but understand it, guide its ethical use, and ensure it serves humanity. Becoming a 21st century doctor means you must be a lifelong learner. Yes, medical knowledge is evolving rapidly. New discoveries emerging daily. Continuous professional development, research engagement, and openness to innovation ensures that physicians remain at the forefront of evidence-based practice. So, you are called to learn, to unlearn, and to relearn. For you to be a 21st century doctor, you must be willing to learn. You must be a lifelong learner. It also means that you must have strong communication and leadership skills. You must be a communicator and a leader. Modern doctors must develop strong communication and leadership skills because they work in multidisciplinary teams, manage complex cases, and often advocate for health policy reforms. So, effective leadership improves not only clinical outcomes but also system wide healthcare delivery. So, Becoming a 21st century doctor means that you must embrace health in its fullest context. Most importantly, the doctors of this generation must see health in its fullest context, shaped not only by biological but also by society, environmental, cultural, and opportunity. These are must bring these things that must bring into consideration. You are not just treating illness, you are advocating for prevention, for equity, for mental well-being, and for community health. That is why the World Health Organization defines health as a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity, which means you must bring into consideration the biopsychosocial factors that could impact health positively or negatively. So, in conclusion, becoming a 21st century doctor means that you must be a scientist, a caregiver, a leader, a communicator, and an innovator. Above all, a servant to humanity. As you step forward into this noble journey, I want you to carry in mind not just knowledge, but compassion, not just skills, but purpose, not just ambition, but integrity. The future of medicine is not only in our hands, it should also be in our hearts. May the Lord bless you as you continue in your noble profession. May the Lord see you through. Thank you very much for listening. See you some other time.